Whenever you're ready.
Okay. All right, today we're going to be discussing the typical pattern of a disease associated with microorganisms, and then 3 different patterns of disease. So keep in mind when I draw this, that our x-axis is going to be time, and our y-axis is going to be number of microbes or the severity or intensity of the signs and symptoms. So before you're infected with the microorganism, or right on the onset of infection, you're going to be down here. So onset of infection, very low to 0 number of microbes and no signs and symptoms. So as the disease starts to progress, you go from your period of infection to what is called the prodromal period. And during the prodromal period, this is typically associated with low number of infectious microorganisms and a very low level of signs and symptoms. So this is typically when you're saying, I think I'm starting to come down with something, very, very mild and vague signs and symptoms. So following the prodromal period, what you get to is, this is your stage of illness. And what this is the peak. Okay, this is typically the peak of your signs and symptoms. It's the highest number of microorganisms that you're going to experience during the disease. And this is typically when you feel the worst, and this is typically when you say, okay, I really need to seek a healthcare professional's assistance, and your immune system hasn't fully kicked in. So if your immune system kicks in, and or you have some type of medical treatment, what happens next is the number of microorganisms and the signs and symptoms start to decline. Okay, so this is referred to as the period of decline. And it's during this particular period that if the disease is not fatal, the number of microorganisms will go down, and this will correlate with the decrease in the signs and symptoms that's present with the disease. It's really important to point out that during this particular phase, an individual is really susceptible to a secondary type of infection. So once the decline period has passed, next we go to a period of convalescence. Okay? And during this particular time period, the body is really recovering from the disease and returning back to a state of health. I'm not going all the way back to 0 number of microorganisms here, because for many individuals, and depending on their immune system and the type of infectious disease in the body, this may never return to 0. And this is especially true with latent infections, which we'll talk about next. All right, so typically many diseases are characterized by the pattern of disease that they cause. So I'm going to discuss 3. So once again, okay, we're going to use the same y and x axis. So on our y-axis here, we have the number of microbes or the severity of signs and symptoms, and down here we're still looking at time. So with an acute type of disease, we're going to start at 0. We're going to have a peak, okay, and we're going to have a rapid decline. Okay, so 0, rapid incline, rapid decline in our severity of signs and symptoms and our number of microorganisms over time. So we're going to rapidly clear it. And a really good example of a disease that has this pattern is influenza. Okay, so rapid onset, rapid decline. The next one that I want to talk about is a chronic type of disease. So we have increase that happens a little more slowly and gradually, and it tends to stay with the host for a longer period of time. Okay, so this is our signs and symptoms, a little more slower to go up, typically not as intensified as the signs and symptoms we see with an acute infection, but they tend to stay with the host much longer. And so this, some good examples of diseases with this particular pattern are TB or hepatitis B. And then lastly, I want to talk about latent types of diseases. Okay, so in this type of disease, you have your infection, you get your peak, then you have your decline, and notice I'm not going all the way back to 0. So what happens is this goes just low enough so that you don't have signs and symptoms within the host, but it's still within the host at low enough levels that if you have reactivation of that particular infectious agent, it can start multiplying again and causing severe signs and symptoms again, and this can recur for the lifetime of the host. And so really good example of infectious agents that cause this type of disease are your herpes viruses. Okay? So today we discussed typical pattern of disease and your 5 different stages: incubation, prodromal, illness, decline, and convalescence, and then 3 different patterns of disease: your acute, chronic, and your latent. Thank you.